So while waiting for Well, maybe I'll pass the mic over to Mr. Raymond San Pascual, who will give us the welcoming address. He's the Executive Director of Healthcare Without Arms, Southeast Asia. And let me introduce him. He is a population health and environmental policy advocate. Raymond brings with him years of experience working in civil society organizations, engaged in social development work, and has dedicated many years on policy development, advocacy, and working with policymakers and stakeholders on population, health, environment, and sustainable development issues. Having worked with an extensive network of parliamentarians, health professionals, community, and civil society leaders, he has helped form and strengthen coalitions of advocates upholding health and social justice in the Philippines and across the Asia-Pacific region. Over to you, Mon.
Thank you very much, Claire, and to everyone that are spending their afternoon on this Friday with us in the very timely launch of the Southeast Asia Alliance on Health and Climate. And I'd like to welcome everyone, one being joyful, but at the same time, recall the lost lives and the destruction of properties of farms that have happened over the past weeks in a big piece of Southeast Asia, devastated by the series of the storms, 5 in the Philippines, 6 in Vietnam, but as well impacting Cambodia and Laos. So at least 4 countries in the Southeast Asia over the past 5 or 6 weeks have been affected by a series of significant typhoons. And this just reminds us why, therefore, we need to come together as healthcare practitioners, advocates, policymakers, clinicians, and think of how else and what else can we do to avert the very terrible impact of climate change in our region, in the lives of common people. And in our case, in my own city, these are people who are in my neighborhood, who are still, whether they're still in their evacuation centers, in schools, simply because their houses are gone. They have no home to go back to. And we are in a city. So think about those in the rural areas, whether near the city in Hanoi, in certain cities in Laos, and the rural communities of Southeast Asia. Climate change do affect rainfall patterns, storms, and droughts, and these are things that we will be discussing the rest of this afternoon. But just to remind ourselves that as we come together and take on the challenge, let's think of the very lives of the people in our region and of the globe that are now, not in the future, not tomorrow, not in the next 10 years, or not in the next 20 years, but now are suffering from the brunt of day-to-day impact of climate change. So with that, as we put significance on the lives of these ordinary people, we welcome you and we enjoy you to start together movement to the health impact of climate, and that will put the leadership of those in the health sector in the middle of such a movement. So we welcome you and thank you for joining us.
Thank you very much, Sir Ramon San Pascual. Thank you very much for welcoming us and for starting off and kicking off this program launch. Sorry, it was the internet connection was a bit intermittent, but I am back, and thank you once again, Ramon San Pascual, for that welcoming message. Good afternoon, everybody. Welcome to the Southeast Asia launching of RISE, a leadership and advocacy platform aiming to support healthcare leaders and its allies in advancing climate action and a healthy recovery in the region. So today, we will be gathering doctors, nurses, medical students, environmental justice advocates, and community leaders to work together for a healthy, equitable recovery beyond COVID-19 and the climate crisis. You really could have been doing other things in this beautiful Friday afternoon, but you're here with us for this very momentous occasion. So we thank you so much for your participation. Once again, my name is Val Vestille. I'm your host. Thank you, Claire, for that introduction. So allow me to read a few house rules before we begin. All right, it's on your screens right now. Number one, please put your audios on mute at all times unless the host allows it. Number two, turn on the Zoom chat box by clicking the icon at the bottom of your screen. Number three, now you may input your comments, feedbacks, and questions. If you're sharing the discussion on social media, please use our hashtags below, hashtag healthy recovery and hashtag rise for health climate. Now the event highlights and presentations will be shared after this webinar. So the story that has gripped the countries of Southeast Asia in the last decade is a story of climate disasters, economic and social struggles, and now a formidable global pandemic. And in spite of that, the journey of this region is also about standing up, courageously facing adversity, and uniting to build better. And this is where RISE comes from. RISE signifies responsiveness, resilience, and recovery. It also means facing the problem and mobilizing people and institutions towards right solutions in this crucial moment in history. RISE aims to strengthen and mobilize healthcare leadership on climate action and a healthy recovery for Southeast Asia. Now, this launch is of course happening all over Southeast Asia. That's why we are all dressed in our national attires. And we want to know which city you are participating from. You know, we want to get a feel that even though we're miles apart from each other, we have been brought together through these digital innovations such as Zoom. So please enter your answer in the chat box found on the right side of the screen. Please tell us which city you are participating from. I'm gonna read some comments in the chat box. We have Iloilo City. Maayong hapon sa inyo mga tanan dira sa Iloilo. We are from Manila, from Kuala Lumpur, Marikina, Kuala Lumpur, all the way from India. Wow, joining from France, je ne peux pas le français. Quezon City, Indonesia, Makati, Quezon City, Penang, Singapore, Manila, India, Binyan, Malaysia, Kuala Lumpur, Indonesia, India. These are all beautiful places. It's great to know that we have over 60 participants here from cities as far as Manila, Penang, India, and even France. Thank you so much for coming to our launching. Let's get on straight away with our program proper. As you all know, Ramon San Pascual already opened us in the program, and so we now proceed to our next message. Our next message will be coming from a member of Healthcare Without Harm, Asia's Advisory Council. He is the National Coordinator of the Health Promoting Hospitals Network of Indonesia. He obtained his Master's in Public Health from the Indonesia University. He served as Director of R. Syamsuddin SH General Hospital in Sukabumi City and head of the Indonesian Regional Hospital Association of West Java Province. This afternoon is going to talk about healthcare at the heart of climate action and recovery for Southeast Asia. Let's give a digital round of applause to Dr. H. Suherman.
Thank you. Thank you. Yeah. Good afternoon for everyone. I would like to graduate to all of the participants from the launch of the RISE. And may I speak as a Asian Advisory Council for opening address by the Healthcare Development Asia. Thank you for facilitating me. And then I would like to continue to because the time is. Could you place the second presentation? Yeah. Second presentation part? Yeah, okay. Bismillahirrahmanirrahim. In the name of Allah, the Great and the Merciful. I think we would like to make awareness about the situation today because now we are in the emergency situation. Let's we think in the crisis and then we think make work out in the crisis situation. And the next, we would like to share to you that this is about Asia, especially Southeast Asia, is particularly vulnerable for the climate change. Like Mr. Mon say, look around in our country, in Asia. The Global Risk Index in 2020, cities of the Philippines, Vietnam, Pakistan, and Thailand, Myanmar, Bangladesh, and Nepal, is among of the 10 countries most impacted by the climate change. In terms of death and economic losses from climate event from 1990 to 1990 and 2080. And the next, we look to the round. I think it is, please back to the another. If we look to our country, maybe among those bearing of the heaviest burden of the climate change are the poor in Asia. Look at the picture, so many stunting. The paper state that food security and nutrition and 2020 report find that majority and undernourished people in the world's 381 million live in Asia. With climate change, the population living in poverty would increase by 35 and 120 billion by 2030 relative to the future without the climate change. Next. We looked at that. In addition, the pandemic of COVID-19 has badly impacted to the Southeast Asia. We don't know how long of the COVID-19 alive with us. Don't be panicked and frustrated. Look forward and do more for our community and livelihoods. Health system has been stretched to and beyond breaking point. We lost a lot of professionals also apart. We understand it takes time to rebuild for the future. Comorbids, hunger, and malnutrition of the most vulnerable population group are likely to concern further to the health and the socioeconomic impact of the COVID-19. If you look to the healthcare is the only sector of the global economy that has been healing in mission now and on forever. In the climate imperative for the healthcare sector is therefore to take urgent leadership for the mitigation of greenhouse gas emission and pollution, the building of a resilience of the climate change and the pandemic impact, and advocacy for the health equity, climate justice, and transformation of the healthcare system. Healthcare without harm works to transform healthcare worldwide so that it's reduced to environment footprint. Become a community and charge for the sustainability and leader in the global movement for the environment, health, and justice, We look to the 2019. We look to the 2019. Healthcare Vietnam issued a report declaring that healthcare contributes to 42% of the global greenhouse gas emission, above than 516 coal power station, and 30% of the related to urban energy use. In healthcare, where a country is the world be the fifth largest emitter to the world, produce 5 tons of the waste per year, generate 20% lost water per bed per day, hazardous waste 50% from the total waste spending, regulated waste 40% of the waste management budget. In keeping with the principle of the first do not harm, Healthcare Vietnam has made climate action as a major focus with the aim of the protecting public health and the planet from the impact of the climate change. The start of this healthcare sector is reducing its own carbon footprint to support the ambition of the Paris Climate Agreement. Healthcare without harm. Healthcare without harm must work very tightly on this through in the network and the program, including the Global Green and Healthy Hospital Network. The healthcare climate change. Worldwide, healthcare climate change partners have committed to reduce more than 34 billion tons of the carbon dioxide equivalent and plan to rebuild resilience and take leadership in the climate education and advocacy. We look to the WHO manifestation for the healthy recovery on COVID-19, which was issued in May 23 in the state. Healthcare without harm also support this manifesto. Health workers are the single most trusted profession in the world. Their skill, dedication, bravery, and compassion as self-conscious life during the COVID-19 crisis. The health professionals from all around the world have shown that they are also strong supporters on action to protect an environment and terribly the health of the population that they serve. They have ready to champion for the green, healthy, and prosperous society of the future. This is why healthcare must be the heart of the climate action and the recovery of the Southeast Asia. Therefore, the Asia Pacific Council is proud that Healthcare Without Harm Southeast Asia is setting up the RISE, Southeast Asia Alliance for the Health and Climate, which we focus on building a healthy, justice, and resilient Southeast Asia through healthcare leadership. Our heartiest congratulations to all of the participants in the RISE. Thank you so much. God bless you. Maybe we are good better for the future. Thank you.
Thank you very much, Dr. H. Suherman. Your message is truly appreciated. Thank you for reminding us of why we are all gathered here this afternoon. We now proceed to our keynote message, and today we are graced by an exemplary person in the field of planetary health. Our keynote speaker is a Filipino physician and chief planetary doctor of PH Lab, a global think and do tank for advancing the health of both people and the planet, an Obama Foundation Asia Pacific leader and Aspen Institute New Voices fellow. Dr. Renzo recently finished his Doctor of Public Health degree at Harvard University. Renzo is also a member of the editorial advisory board of the Lancet Planetary Health, advisor to the Forum on Climate Change, and Health of the World Innovation Summit for Health, and Next Generation One Health advisor of the Lancet One Health Commission hosted by the University of Oslo. Previously, he served as Asia coordinator of the Healthy Energy Initiative in Healthcare Without Harm. His presentation is about the climate emergency as a health emergency. Ladies and gentlemen, Dr. Renzo Ginto.
Thank you very much, Val, and thank you very much, Healthcare Without Harm. And it's really amazing to be surrounded by fellow planetary health advocates from across Southeast Asia. I'm really thrilled to be having a reunion with several of my colleagues here. And I'm also meeting new people. And so really loving the energy, and I hope we can transform this positive energy, from Zoom to the real world of practice and action. And so looking forward to planning with you on how we can rise above, the challenge of climate change and health. And so for the next couple of minutes, and I appreciate the introductions by Mon, by our other colleagues, and now, basically I'm going to reinforce that by sharing, what I always say as my 3 S's. First, we need to know what is the story that we are telling. The second S is what is the science, because we need to back our stories with the most up-to-date, best available science about climate and health. Especially that a lot of us here are health professionals. We are very much devoted to, evidence-based medicine. And so we need to really appreciate the evidence. And then finally, the third S, from story to science, we need to know the solutions. And we might be always thinking about climate change as a doom and gloom issue, but hopefully from this presentation and in the conversations that we will be having later, we will all realize that the toolbox, the solutions toolbox, is huge and diverse and really is within our reach. And all we have to do is to rise up and embrace the challenge. So I want to first start by acknowledging, of course, the COVID moment where we are in. And I really wanted to show to you this graph. As you can see, the Southeast Asian countries are almost absent in this graph. And that is good news. Southeast Asia is the first region to be hit by COVID-19. The first case outside of Wuhan was in Thailand. But after several months, as you can see, Southeast Asia was able to weather the pandemic. We were able to really mount effective and fast response, early response. Now the challenge is, how can we replicate that in climate action? How can we be as fast and as comprehensive, as effective, in also trying to address climate change in the same way we were able to contain COVID-19? So, as you can see, US is still at the top of the rankings. Maybe that will change now that their leadership will be changing in a few months' time. But also, there's so much suffering in the world. Almost 60 million have already been affected. And we need to get our acts together to combat COVID-19, but also to combat and prevent climate catastrophe. You might be asking, how is COVID-19 and climate change interconnected? I'm pretty sure that is a question that is running in everyone's minds. Of course, it's hard to attribute a single pandemic to climate change. We need multiple outbreaks in the years and decades to come to say that climate change really has increased, the likelihood of pandemics. As you can see, the projections say that the planet's health is essential to preventing infectious diseases. A warming planet is conducive for the re-emergence of old diseases and the emergence of new ones. But of course, what we want to do in public health, in healthcare, is that all this mathematical modeling, all these projections do not happen. That is actually the nightmare of modelers, when their projections become reality. And that is the same in COVID. That should be the same mindset when it comes to climate change. We don't want the IPCC projections to actually happen within our lifetime. And so there is really a strong imperative for climate action and urgent climate action. The region is no stranger to infectious diseases. We've always been described as a hotspot for emerging infectious diseases, influenza, chikungunya, Nipah virus in Thailand, Japanese encephalitis, all of these, we've already experienced this. We will continue to experience these infectious diseases if we do not get our acts together. And more infectious diseases will be generated by climate change and all its related phenomena. And so we really need to prepare for the future, but also we need to prevent these from happening. And again, as I've said, kudos to Southeast Asia and to Asia Pacific in general for so far the good performance when it comes to pandemic response. In August, September rather, the Lancet released these rankings of countries. Which countries in the world are top performing in terms of the COVID response? As you can see, almost all the countries at the top tier are from Southeast Asia. I think excluding the Philippines and Indonesia, which are way bigger countries, but also with very interesting political dynamics. And so, how do we replicate that to climate change? As you can see in this map, this is a map that shows the climate vulnerability of Southeast Asian countries. The first message is that the whole region is highly vulnerable to climate change and its health effects. We live in a climate and health hotspot, being a tropical region. But as you can see here, the redder the country is, the higher the vulnerability to climate change it has. And unfortunately, my country, the Philippines, is the reddest of them all. But that does not say the other surrounding countries are immune to climate change and its health effects. And this is the sad story. In the past few months, we've been celebrating, climate change may have been abated because cars have stopped being driven, coal-fired power plants have stopped operating for a while, carbon emissions have gone down, air pollution has been reduced. Cities now have bluer skies and much more breathable air. But this is the reality. As the economies are reopening, emissions are going back to the old normal. And I know, we're all discussing, what is the new normal? But actually what's happening when it comes to climate change and carbon emissions, we're all going back to our original 2020 trajectory. And this is the other important thing. We thought that when climate change showed up at our doorstep, when COVID-19 showed up at our doorstep, climate change disappeared. No, that is not the case. Climate change and its effects are still anticipated to happen. In the Philippines, Mon already mentioned about the typhoons, but in Europe, the heat waves have come because of, the summer season, locust crisis in Africa, the hurricanes in the Caribbean, and when January arrives, the bushfires in Australia will be back. And so climate change continues to happen. And as I've mentioned, and as Mon already mentioned, these past 2 weeks, you've seen all these images. Mon lives near the river where a lot of these houses were, inundated, if not destroyed. And so now Filipinos who are affected by natural calamities are torn between two different crises. On one hand, do I stay in the house, protect myself from COVID, but suffer the consequences of flooding and maybe my roof will get blown away by the wind? Or move to the evacuation center so that I'll be protected from climate-related health diseases, but then I violate social distancing and be exposed to the virus along with the other evacuees. So these are some of the real challenges that we are seeing, multiple crises compounding each other. And so, climate change really has lots of effects. And, for instance, these are just some of the numbers, and they're scary. We're afraid of the COVID numbers, but these are the additional numbers that we expect, from 2030 to 2050. These are gross underestimates from the World Health Organization. These are just for the diseases that can be modeled. There are other diseases that are hard to quantify. And so we should start really thinking about the health consequences of climate change in the years and decades to come. And this is the other important part of the climate and health story, that it is a climate and health justice issue. The leading countries that have emitted the greatest amount of greenhouse gases to the atmosphere are not the same countries that will bear the brunt. As you can see, there are two maps here, and Asia is one of the parts of the world that will be certainly affected by climate change. So I realize I only have around 5 minutes, and because we're pressed for time, I'll just do a brief survey. As you can see, natural disasters are becoming more frequent and more intense because of climate change. you know, tropical diseases are now increasing again in frequency, but also moving to parts of the world where they were not originally existing, such as in Europe, like dengue. Okay? We know that air pollution and climate change are related because they have the same source, the same cars, the same factories, the same coal-fired power plants that burn fossil fuels are the ones generating both problems. And so if we address the source, we improve air quality, we prevent climate change, we improve health overall. Mental health also is already being affected by climate change, not just as a result of the natural disasters, you know, post-traumatic stress disorder, but also, as you can see at the bottom, there's this concept called ecological grief and anxiety, the long-term, more subtle effects to mental health because of the growing uncertainty, you know, food insecurity, et cetera, and et cetera. I invite you to visit this website of the New England Journal of Medicine. If you are a clinician, it tells you what are the health conditions that are linked to climate and what we can do in clinical practice. So for instance, there's growing evidence that even chronic kidney disease is increasing because of increased exposure to heat. So heat stress nephropathy, as mentioned here. And even the medicines that we consume, you know, because they are exposed to intense heat or, you know, high humidity, we might be actually seeing these medicines to be, you know, diluted in terms of their efficacy, or the ability of our bodies to accept the medicine might change, you know, because of, again, some interaction and adverse reaction happening. I'll not go into detail in this slide. We need to start looking at the food system, because the food system that generates climate change because of carbon emissions is also the same food system that makes us either obese or undernourished. And so we really need to start talking about food. And there is actually a proposal which is called a planetary health diet. How can we shift the global diet from a predominantly meat-based to a predominantly plant-based diet, which is good for people's health and the planet's health? You know, ocean levels are increasing, sea level rise. So, you know, we're talking about rising up, but this is the rise that we don't want to happen, which is sea level rise. And there's growing evidence that because of sea level rise, drinking water is becoming highly salinized because of the intrusion of seawater into freshwater sources. Okay? And worst case scenario, you know, your water will not become salty. Your island might actually disappear. And that is already happening in our neighboring countries in the Pacific. And so we can anticipate a new form of migration, which is climate-induced migration. How are we going to facilitate dignified migration for people living in low-lying islands who will need new places to live in? And so we really don't have time, you know. UN said we only have, you know, actually from 2020, it's 10 years remaining, 5% chance of achieving the Paris goals, okay? And, you know, we've seen during the pandemic that our healthcare systems are not ready for climate change. So are we ready to build health systems that consider the climate? Are we ready to consider now not just our people, but also our planet as our patients? Okay? And it's important because we know that health is not created in the hospital. It's not created by your medicine and your x-ray machine. It's actually created by the social, environmental, and behavioral factors. Pat, just give me a few more minutes because I want to present rice. So we need a planetary health approach. We need to have an integrated vision for the health of humanity and the health of the planet as well. And, you know, sorry, I'll be skipping a lot, but these are the solutions actually. And maybe later we'll get back to this. But, you know, we now are given this chance. You know, for the past several weeks, we've been talking about flattening the curve of COVID. We need to also flatten the curve of our carbon emissions, our ecological footprint, because, you know, if not, you know, we're afraid of the first wave of COVID, the second wave of COVID. We should be also, if not more afraid, of the tsunami of climate change and health consequences that can happen in the years and decades to come. And so we should all rise. We should all rise up to the challenge. We should now step up And it's great that now Southeast Asia's healthcare leaders are coming together to be mobilized for climate action, health equity, and resilience. And let's use the COVID moment as a moment for reset and recovery. So this is the vision of RISE, and thanks to Claire Westwood for sharing with me this. So we want climate action, we want health equity, really front and center in our region's work. And we are building an inclusive and competent alliance of healthcare leaders. And so we're really excited that there's many people here in the room, Zoom room, and we hope to increase our tribe. And these are some of the objectives to form this alliance that will really build our capacity to address these challenges. But we also want to be a critical driver for decarbonization, for achieving environmental sustainability in the region. And so are we ready to rise to the challenge? That is the question. I'm really looking forward to the voices and the commitments from our leaders in this Zoom room today. Thank you very much.
Thank you very much, Dr. Renzo Guindo, for that important reminder. He gave us the thrilling and the creeping story of the climate crisis, and he also gave us the most available and most up-to-date science. And of course, he enlisted the different solutions that we have to at least try and render to face these crises that we are currently up against. And so it was a very insightful presentation on the nexus between healthcare and climate action. So thank you very much, Dr. Renzo Guindo, for that presentation. Now, doctors, nurses, and other care providers are increasingly witnessing the climate crisis as a health crisis that directly impacts their patients. They're also discovering that their hospitals actually contribute to the problem. Now they're stepping up to protect people and the planet by advocating for a transition to clean and renewable energy and by minimizing their carbon footprint as much as possible. Now, watch this joint video project of Healthcare Without Harm, Skoll Foundation, and Freethink.
I used to see black spots on the lungs of mostly smokers. Over the last decade or so, I saw a series of teenagers with black spots on the lung. And I thought to myself, oh my God, what's happening?
What could be causing this epidemic of lung disease? The answer, it turned out, was in the air.
In India, the bulk of pollution comes from crop burning, garbage being burned, vehicular pollution, and industry, which releases tons and tons of toxic smoke into the air. I have seen it with my own eyes. We need to do something about it.
Fossil fuel combustion is a main cause of air pollution in India and around the world. It's also the biggest driver of climate change.
The bushfire experience across Australia was an extraordinary experience. We had weeks and months in some places of hazardous air pollution and poor air quality. Some thousands of people were in hospital with heart disease and arrhythmias. They had heart attacks and strokes. We know that lung infections and pneumonia is made more likely by exposure to air pollution of that nature.
Health professionals are realizing that climate change is one of the greatest health threats of the 21st century.
Climate change is fundamentally a public health issue. We know from ample evidence that we are in a critical moment when it comes to climate action. And unfortunately, the healthcare sector, both in the US and around the world, is a huge contributor to global greenhouse gas emissions and climate change.
If healthcare was a country, it would be the 5th largest climate polluter on the planet. And if we're going to protect people's health from climate change, we need to move away from fossil fuels. The sector needs to take action to reduce its own emissions.
These are doctors from all around the world tackling climate change as a public health crisis, while also bringing sustainable practices to a major contributor to climate change: healthcare.
I do get asked sometimes, why would a pediatrician be involved in climate action? I feel that it is my duty to think about what are the factors outside of my clinic that really are contributing to my patients' well-being. If the operations of healthcare delivery are doing harm, that seems completely antithetical to the oath that I took.
What we need to do is really reinvent healthcare in the 21st century. Overall, the biggest source of healthcare's climate footprint is the sector's use of fossil fuels, whether it's burning fossil fuels on site to produce energy, whether it's buying energy produced by coal, oil, and gas, or whether it's in the supply chain, which is a huge part of healthcare's footprint.
What's shifted for me in the last year or two has been the profound recognition that climate change affects us now. If we were better at addressing disease before it gets to the point where people end up in hospital, then we can significantly decrease the carbon footprint. We need to be proactive in taking that longer-term view.
When healthcare providers realize that their actions and the sector that they work for is actually contributing to the burden of disease, they're ready to take action.
The whole debate about climate change is live in our community. There has been a central commitment that the NHS will meet net zero by 2050. We employ around 1.7 million staff. I think we're the 5th biggest employer in the world. We're responsible for about 5% of the UK's carbon emissions. At Newcastle hospitals, we now recycle 43% of our non-clinical waste. 60% of our staff come into work using sustainable modes of travel, and we've banned use of diesel and petrol cars in our fleet.
Doctors, nurses, hospitals, and health systems in more than 70 countries have joined together with the international network Healthcare Without Harm to build a global movement for sustainable and equitable healthcare, for clean air, and for a healthy climate.
If we look at this health and climate change dynamic, we see hope. We see hope because individual action makes a difference to your health and well-being.
So the first step to solution is to become aware, awakened, and then only the action will come.
Health professionals today who are interested in climate action have so many opportunities to get involved that relate to energy efficiency, clean energy, sustainable purchasing, healthier foods. We're very powerful as exemplars for our patients.
Two of the greatest health threats of the 21st century are climate change and a global pandemic. And we've got one on top of the other.
I am optimistic that if we can contend with one threat at the moment, we can probably contend with a whole series of threats at the moment. It's the most extraordinary time to be imagining the human future.
If you want to have healthy people, you need to have a healthy planet.
For more on how health professionals are advocating for a healthy planet and what you can do, please visit healthforclimate.org.
I love that very much. You can't have a healthy planet without healthy people. Thank you very much. I would like to know if our audiences are still with us. We have heard from 3 great speakers and we want to hear from you. Comment down below, comment down on our Zoom chat box a keyword of a realization or an insight. It can be a word or a phrase of anything that you learned from the 3 talks. All right, so this is also just a testing whether you're really paying attention. Is there any word, keyword, or phrase that you would just like to share with us in the comment section below? Whether it's planetary health, I'm giving you answers already, or the climate crisis. Can you just comment on our Zoom chat box a keyword or a key phrase that you have learned so far? Now, please promote our Southeast Asia launching for RISE on our social media channels. On Facebook, it's at HCWH Asia, Instagram at HCWH Asia, Twitter at No Harm Asia, website noharm-asia.org. And if we have any members from the media, press. Now, we'd like to move forward with the presentation and introduction of our RISE Southeast Asia partners. They will share with us the climate and health situation in their respective countries and show how, as health professionals and environment activists, they can help address the climate crisis. First up in our Southeast Asia partner is from Indonesia, Dr. Hervey Nuriania Megareza, Operational Director of Kahaya Kalbu Clinic. And representing the Philippines is Dr. Ronald Law, Chief of Preparedness Division, Health Emergency Management Bureau, Philippines, of the Department of Health. Representing Malaysia is Mr. Hafiz Amirol, Consultant at Mercy Malaysia, Network Coordinator at Asian Disaster Reduction and Response Network. From Taiwan, Dr. Ming Nan Lin, Vice Superintendent of Dalin Tzu Chi General Hospital in Taiwan. And for Singapore, Ms. Yen Tan, Chief Operating Officer of Khoo Teck Puat Hospital. Let's call on our first panelist from Indonesia, Dr. Hervey Nuriania Megareza. Dr. Hervey?
Okay, thank you, Val. Pat? Okay, thank you. Good afternoon, everyone. I'm Dr. Hervey Nuriania Megareza. Today, I'm very honored to be a part of this great event, RISE Southeast Asia Alliance for Health and Climate virtual launch event. And I am representing Indonesia. Please allow me to convey our perspective about how can RISE Alliance help advance healthcare climate action, health equity, resilience, and recovery in our country and also in the Southeast Asia. Next slide, Pats. Okay, currently in Indonesia, we are still working on efforts related to address the COVID-19 pandemic, simultaneously seeking on health and socioeconomic recovery as well. Meanwhile, we cannot rule out the environmentally concerned. It is no less important to take an immediate response as they may increase the risk of future hazards. Next. Okay, it is undeniable that the process of health recovery and also the socioeconomic recovery is influenced by our geographical background, which consists of approximately 16,000 islands that require spatial consideration related to disaster mitigations. Next slide. So many challenging issues in Indonesia related with large populations, low public health and environment awareness, exposure to natural disaster, issue of deforestation, river and sea pollutions. Next slide. Air pollution due to fossil fuel burning, and also extreme weather patterns that leads to disruption of agricultural. This emphasizes the important needs for responsive and resilient healthcare facilities to face the future challenges related with climate change and also to face the shifting, the burden of disease in the society. Next slide. Of course, this is an urgent call for Indonesia to have a direction and clear policy in favor of sustainable nearly everywhere, including health services for bringing up the message of health equity. Toward this hope, of course, we require a strong public support to realize. Next slide. RISE Alliance is a platform that can help us to provide a new perspective about sustainable health through its message of climate action, health equity, health recovery, and also resilience. The vision of RISE Alliance can be adapted by healthcare facilities in Indonesia to pay attention on the clinical governance, not only on health aspect, but also social, economy, and environment security and sustainability. Health professionals, of course, play an active role to campaign and advocate to the local or regional government to build a healthy workplace for patients, staff, community, and environment. One of these possible areas is the decarbonization of hospitals to reduce their greenhouse gas emissions. Next slide, please. The RISE Alliance can help influence approximately 3,000 hospitals in Indonesia through information, resources, and capacity building on climate and health. And we are waiting for RISE support for the presence of pilot climate smart healthcare in Indonesia to be a model for other hospital development. RISE as an alliance in Southeast Asia can build a bridge, hopefully can build a bridge for networking and best practices, sharing knowledge and experience about model protocols, policies, and regulation, as well as international instruments of research related to the climate and health. Next. No one can predict next crisis, but well-preparedness of health services to address the disaster will decrease material and fatalities losses, convinced that healthcare is resilient to adapt with the future challenges. RISE Indonesia, which consists of various both hospital and non-hospital, private and government partners, can be a platform for positive advocacy related with health and climate issue, not only with the Ministry of Forestry and Environment, but also with the Ministry of Health to create strong civil society that professionally giving the input to keep the government on track with its climate goals for green Indonesia recovery. And thank you very much for this kind of opportunities. Terima kasih and greeting from us, RISE Indonesia. Once again, congratulations for RISE Southeast Asia. Thank you so much. Well,
thank you so much, Dr. Hervin Oriania Negareza from Indonesia. Up next, we have from the Philippines, Dr. Ronald Lau.
Good afternoon, everyone. I'm happy to be here for health and the climate. So on the question, how can the RISE Alliance help advance healthcare climate action, health equity, resilience, and recovery in the Philippines and in our region, Southeast Asia? So the Philippines believes that the RISE Alliance can do this through the following ways. First, by raising awareness on climate and health issues, their immediate and long-term impacts to current and future generations. So in a country, the untoward risks and consequences of climate change are actual felt experiences from urban Metro Manila to the far reaches of our beautiful islands, along coastal areas, in disadvantaged areas affecting our vulnerable population. Extreme temperature directly affects the health of our people. It also threatens our food and water security, constraining our life support systems. Climate-sensitive diseases are always on the rise, unnecessarily increasing the morbidity and mortality. For the most part, extreme weather events, natural disasters like typhoons and floods, continue to threaten the safety, health, and well-being of Filipinos. Our recent experience with a string of destructive typhoons can attest to this. Much worse, climate change magnifies existing health inequalities, leaving behind the more vulnerable and affected among us. All of this would really make the term climate emergency an understatement. The health sector is well positioned to lead this advocacy raising. It has the credibility and expertise to discuss these issues and propose ideas that can be a springboard for consensus and solutions. Second, by spurring concrete actions in the health sector to build resilience to the health impacts of a changed climate. With awareness raised and critical issues defined and looked into, strategies and actions should be crafted and implemented. Climate resilience strategies in the health sector, in the public health programs, in hospital health service delivery, should be done to manage adverse health consequences. Strengthening our health system to respond to climate impacts should be a topmost priority. Equally important, health mitigation should also be promoted to contribute to societal efforts in reducing emissions. The concept of co-benefits should be propagated and concrete measures backed up by effective science and communication should be proposed. Finally, by facilitating exchange of good practices and lessons learned on climate resilience in the health sector. There's a need for a mechanism to share this within the country and regional level to accelerate innovations and actions in climate health and healthy recovery in the context of the pandemic. This can be done through case studies, documentation of good practices, evidence synthesis, and of course, research. This will address gaps in knowledge, create new solutions, and facilitate exchange of good practices and lessons learned. All of these strategies should be started in each country. Those who are members of the alliance, with clear directions and good results, this will create an impetus for action at the regional level. So our approach is more comprehensive, efforts will be maximized, and therefore the outcome and impacts will be achieved sooner than later. Again, the Philippines believes that the RISE Alliance can help advance healthcare climate action, health equity, resilience, and recovery in the Philippines and in the region. Let's take this to new heights and soar together. Thank you very much. Maraming salamat po.
Thank you very much, Dr. Ronald Lau from the Philippines. And now all the way from Malaysia, Mr. Hafiz Amirol. Mr. Hafiz, take it away.
Thank you, everyone. My name is Hafiz Amirul from Malaysia, and allow me to share on how can the RISE Alliance help advance healthcare, climate action, health equity, resilience, and recovery in Malaysia and in Southeast Asia. The Malaysian Ministry of Health has taken some steps on climate change adaptation for government hospitals, but generally much still needs to be done to improve the level of awareness and proactive action by the healthcare sector in Malaysia, especially on climate action, resilience, health equity, and health recovery from COVID-19. Malaysians have the misconception that climate change will not affect them just because we don't have as many typhoons and floods as other Southeast Asian countries. But this is a fallacy. Climate change is a health emergency. Rising temperatures and heat waves will affect those with chronic medical conditions, the aged and young children adversely. Climate change will increase the transmission of vector-borne diseases like dengue and malaria, waterborne diseases like cholera, and zoonotic diseases. In Malaysia, dengue is still an ongoing challenge. Can we afford for this to worsen drastically? As sea level rises, this phenomenon will affect the immediate coastal areas, given that West Malaysia is a peninsula and East Malaysia is part of an island. Are we prepared for this eventuality? Is the healthcare sector ready for the full impacts of climate change, let alone pandemics? In addition, there are still rural and indigenous Malaysian communities, especially those living in remote areas that do not have access to good healthcare services. The issue of healthcare systems becoming climate and pandemic resilient has become the critical issue as the COVID-19 pandemic has revealed to us how vulnerable we are. We have to stop firefighting, but rebuild a better and more resilient systems as we encounter future threats with worsening climate change and pandemics. Addressing climate-associated health risks and other natural and human-induced hazards are critical. Alongside risks, there is opportunity to rise to the challenge. Responses to climate change have unearthed significant potential for improving both human health and the environment. Climate change challenges are multi-sectoral, and so too are the solutions. There are synergies between climate change-informed health programming, disaster risk reduction, development, and capacity building programs, albeit with recognition that being climate-informed has its own set of requirements. Recognition of these synergies and differences will help to progress climate-informed practice through the identification of co-benefits of action and additional resourcing, as well as a threat multiplier. Climate change can, in this way, too, be a solutions multiplier. The health sector can respond to climate change through both adaptation and mitigation activities, and it is important that these are coordinated with broader international and national initiatives. In addition to coordination with national and regional initiatives such as through the RISE Alliance, action in the country should also align with the strategic focus points of empowerment, evidence building, resources, and implementation. For the most effective measures to reduce vulnerability for climate change, there are programs that improve basic health measures, including public awareness and information campaigns as critical components of tactical programs. Major donors such as the Asian Development Bank, World Bank, and the Green Climate Fund recognize the importance of investing in health mitigation and adaptation activities and are taking a keen interest. With RISE Alliance, progressive, inclusive, and holistic climate action and disaster risk reduction can be moved forward together with the healthcare sector in collaboration with other stakeholders in Malaysia and Southeast Asia. RISE Southeast Asia can help the Malaysian healthcare sector take long overdue leadership on building resilient health systems and communities, improving health equity, reducing our carbon footprint, and putting Malaysia on the road to a healthy recovery, at least from this COVID-19 pandemic. Thank you very much.
Thank you very much, Mr. Hafiz Amirol from Malaysia. And now let's proceed to our Southeast Asia partner from Taiwan, Dr. Mingnan Lin.
Good afternoon, good morning, good evening, my friends from all over the world. Thank you very much for giving me the chance to share the RISE launch of Taiwan. We all know that climate change is the greatest challenge of the 21st century. It is threatening all the species in the world and all the aspects of the environment we live, increasing the risks to human health continually. The public health and healthcare sector has rapidly increased its engagement on climate change and health recently by providing a better understanding of the links between climate change and health, raising awareness of the health threats, offering solutions to avoid the worst impact, and assessing the health benefit of climate action. Historically, the healthcare sector enjoyed a high level of trust compared to other sectors in society. Healthcare professionals provide medical services to heal people's physical and mental illness, conduct health promotion programs to improve people's health and prevent diseases. It is time to heal the environment now as well. Healthcare system consume a huge amount of energy and produce lots of medical waste. To be global green and healthy hospitals, we have the responsibility to facilitate and promote the engagement of the health community as trusted, connected, and committed advocates for climate action. Since the year 2010, Taiwan has been engaging climate action across all levels of governments and relevant stakeholders. By actively participating in the health promoting hospital international network, more than 120 hospitals in Taiwan pledged to reduce their greenhouse gas emission by 12% starting from the year 2012. The goal was achieved last year. Taiwan used two approaches to engage the healthcare sector in climate action, top-down and bottom-up. The Health Promotion Administration put a green hospital program into the hospital accreditation standards, which requires the hospital to take action to oversee their climate impacts in the daily services and mitigate their greenhouse gas emission. Improving climate resilience will be put into the standards next year for the hospital to prepare them to face climate change impact better. Zoonotic diseases such as SARS and COVID-19 are the results of human invasions into wildlife habitats. They are also caused in part by climate events or temperature rise, which put a lot of stress on people and animals, forcing them to migrate into each other's territories. Pandemics place a lot of burden on the healthcare sector too. In order to treat the root causes, there's no time to waste for us to take action to combat climate change. advance health equity, and chart a healthy recovery from COVID-19. If we want to work fast, work alone, but if you want to work far, work together. We are happy that we have a group of friends to work together with us toward the right direction and at a steady pace. We are happy to be part of the RISE South Asia Alliance. We are sure that through working together and exchanging experiences with friends in RISE, the healthcare sector can help lead the way to make our Mother Earth a better place for current and future generations. Thank you. 感恩.
Thank you very much, Dr. Ming Nan Lin. And to close this panel of our Southeast Asia partners, we have with us from Singapore, Ms. Yen Tan. Ms. Yen, it's now your turn.
Afternoon, good evening, friends and colleagues, actually, if you ask me. I'm so glad to be in this little conference that everyone put together, and I want to first thank Claire and Raymond for remembering Singapore, really, and also colleagues from Taiwan who has always shown us the way. And my heart is a bit heavy. I only have 9 slides. I just want to quickly bring us through what Khoo Teck Puat Hospital has tried. And Claire reminded me that I have to relate to RISE. I was very honest with her. I am not representing Singapore. In fact, we are representing our hospital only. But there are some precious lessons that we could glimpse from the past and during COVID and post-COVID. So if you could bear with me, I'm just going to quickly bring us through in the next few slides what we have done. And it has been a 20 years of experience, beginning with Alexandra Hospital, but focusing on the last 10 years. Some of us were together last year in our hospital in September, thanks to Raymond, who chose Singapore to be the country to host a conference. And we shared some of our examples and some of the experience and mistake, and we received overwhelming support over the last 6 months. But during COVID, we sort of lost contact, so I'm glad we're back again. I won't explain this one because I think all the speakers before me have already talked about the correlation. Simply put, without a healthy planet, we can't have good healthcare. In the early days when we started this hospital, we had the experience of a playground in 100,000 square meter space in the south of Singapore called the Alexandra Hospital. In that hospital, we were able to try various aspects of sustainability programs. And with that learning, we came over to this hospital and we make a pledge to the community that we live with. We said we will be part of the community. We will not destroy whatever you have done in the last 30 years in Singapore. And we will come and build a healthy community, and we will pledge to have a sustainable environment. And along the way, hopefully our workforce will be healthy. And very upfront, we told ourselves we will build and purchase green, which we did to somewhat. We built green and are continuing to build green. We purchased green, but it was very expensive and we're still having difficulty purchasing 100% green. We try to conserve resources as we build new facilities. For example, new offices block will now be powered by solar panels. We try to enhance a very beautiful environment by using very little resources. And we continue to change and nudge our staff to change the habit to reduce wastages. So some examples of how as a hospital, because we're built near a pond, co-located to a pond, we were able to channel the pond resources to our hospital building. The water is used to irrigate our greeneries here. We use that to have powers in the rooftop, and we use any space that we can to grow vegetables to feed our patients. But very shamefully, it's only 1% of the patient that's being fed with this, and we have a lot of opportunity there. One of the biggest benefit we did was to learn from a great guy in UK on place-making concept. I think we all know that the environment of a hospital can be a highly stressed one. from the patients to the staff who is receiving and providing care, they all go through moments of stress. So consciously throughout the whole hospital, we make sure that there are places that they can make big decisions. For example, outside the ICU, if you have to make a decision with the doctors to plan the end of days journey for your loved ones, there is a corner where you can make that decision. It was conscious in that area. Next slide, please, Claire. Thank you. As I mentioned earlier on, we were very, very lucky compared to most public hospitals. There were 2 hospitals in Singapore that have a pond. Next to them, we have a larger one. The other one is a women and a child hospital. And over this place, we have really made it happen where in the morning, you can really feel very, very relaxed in the morning when the patients needs to go and exercise, or when staff, before they start work, like to have a bit of workout, it's possible. Next slide. And as I explained earlier on, we were able to channel some of the waters of our hospital. But I think most powerful and most successful to me is we were able to change maybe about 20 to 30% of our staff to really come on board with us to start refusing extra packaging, refusing things they don't need in their lives, and then reducing it consciously or reusing it purposefully and recycling it at all times. Next slide. So Claire asked me to dwell on this and relate to RISE, and I think it's appropriate. In the early days when we did our work, it was I do. But in this community that we have built over the 10 years, we have managed to influence tenants, partners to come on board, community to come and join this movement, grassroots leader, some parts of the ministry, some government officials to come on board with us on symbolic days and go with us in this journey, but not to like 50% critical where they are all with us. We're still trying to influence them. Next slide, please, Claire. Or is it the last slide? I think this is the last slide if I'm not wrong. And yes. Last year, as part of the support for healthcare without harm, we commissioned a book to tell everybody how, as a little hospital in the north, we wanted to seek sustainability. We are really very cognizant of the fact that healthcare uses a lot of resources and is not able to replace them. So we said we would try in our little ways in our business operations, how do we put back in the ways? And the team came together and authored a book for 122 pages and put together all the pictures of experimentation. We were also upfront and honest in all the mistakes that we have made. And we hope you can go to our website and download this book. It's available for everybody if you want to learn of experience and avoid the mistake that we have made. Now I want to come to a few of the topics that my learned colleagues have said over the Zoom. You know, for me, healthcare has a great opportunity in Singapore. Even though I don't represent Singapore, I just thought the fact that for the longest time we have a national IT arm where we could avoid using paper is one big opportunity, not scratched yet. And we have recently formed the national procurement arm to buy things, for logistics. There's another opportunity. And there's a little hospital in the north that could do it to make 20% success. And with the observations and lessons from COVID, I thought we are quite poised to try and push a little bit here. So Claire and Raymond were trying to convince Mrs. Chu, my CEO, on how we should influence the rest of the hospital. We were upfront. We don't represent every hospital, and we have good friends in other hospitals. We try to influence them by telling them what we have done, and we invited them for the conference. And these are some of my personal thoughts, and I don't hold me to it and don't need to quote me, but I just thought to let you know, before COVID, we were cruising along. We thought we built a hospital that the earth could accommodate. And during COVID, I had 2 moments. I want to share what are those moments. The first moment is we were using a lot of single-use disposable items. There was a moment of deep regret. Why didn't we cheat harder to make sure there were some things we could use and recycle them? The second moment came quite fleetingly. It's a moment of fear. There was a moment where the border shut down on us with Malaysia, and a group of us got together with my senior leadership, and we had this fleeting moment, what if we ran out of food? And then post-COVID, I asked myself the question, and we got together again. We said, are we able to rethink how to have sustainable operations? Predominantly, how do we choose the right materials to use from now onwards to make sure we are ready for the next COVID or the next pandemic? And we asked ourselves, even if we choose a material, are we able as a small country to be able to afford it? So those were two questions that we asked ourselves as we prepare for the next pandemic. I will not dwell more. I just want to be honest on how I feel. And over to you, Claire and Val.
Thank you so much, Ms. Yen, for that presentation. And thank you so much for the comprehensive presentations from all our country representatives that really ground us on the current situations of healthcare and climate action in your respective countries. Can you please give everybody a big round of applause, a digital applause? I believe it's very safe to say that we have very strong institutional partners for this program. The next video is a compilation of endorsements and solidarity messages from HCWH, Asia Advisory Council, HCWH's president and founder, Asian Pacific Resources for Women, or ARROW, International Federation of Medical Students Association, and all the way from Geneva, the director of WHO's Department of Public Health, WHO's Department of Public Health, Environment, and Social Determinants of Health. Please watch this video.
My name is Gary Cohn. I'm the president and co-founder of Healthcare Without Harm, and I'm coming to bring you a message of solidarity as you come together and launch RISE, the Southeast Asia Alliance for Health and Climate. It's so important what you're doing, because it's only through being together that we can build resilient healthcare systems and resilient communities, that we can help detox our supply chains and move toward renewable energy, reduce the amount of plastics that we use, and implement climate smart healthcare, that we can together leverage our voices so that we can change the frame around climate change to be a crisis of health, to be a crisis of justice, to be a crisis of how to build an economic development model that embeds sustainability and equity into our frameworks. And we need to amplify all of our messages. We need to learn from each other so that we can fundamentally transform the conversation and the policies in our world to be in service of people and planet. And so the work that you're all doing is absolutely important, and hopefully we can together short circuit our learning curve and build that healthier future together. Good luck with all your efforts.
Overcoming COVID-19 pandemic and addressing climate change are among the biggest challenges facing humanity. Decision makers of each country have to build up various collaborations across nations, regions, and the world more effectively and in more creative ways. I'm very glad to see Southeast Asia Alliance for Health and Climate is launched today. Congratulations. This initiative, I believe, will grow more meaningful interactions, more productive partnerships in leaders and practitioners from both health and climate fields. I hope this initiative will make successful impacts and go beyond the region in the future. Congratulations again. Thank you very much.
My name is Biplavi and I'm representing Asian Pacific Resource and Research Center for Women, ARROW. ARROW is a regional partner of Women on Earth Initiative, which is also known as WORTH. WORTH started in 2018 provides a space to foster innovation and creation of new ideas to solve the challenges that exist in the nexus between gender, SRHR, climate change. And a big shout out to our worth grantee, Bats Olivia from HCWH. Southeast Asian Healthcare Leadership and Advocacy Alliance is important in advancing climate change, health equity, resilience, and a healthy recovery from COVID-19 because all these issues are deeply interlinked. We have several evidences from the region that shows that women and girls are disproportionately impacted during the time of crisis due to the pre-existing gender inequality, affecting their health in general and sexual and reproductive health and rights in particular. Such structural issues should be addressed in all our efforts. The formation of the Alliance is such an effort to ensure that human rights, including SRHR for all, is upheld. Let's work together to build resilience to climate change and COVID and ensure a healthy planet for everyone. Thank you.
Climate change and its effects transcend national boundaries. Similarly, COVID-19 and its ramifications don't stop at a particular country's borders. Both issues exacerbate the existing inequities in our societies and have exposed vulnerabilities in our health systems. These warning signs call for intergenerational and international efforts and leadership to build resilience into our healthcare systems. As a youth-led international organization, IFMSA maintains the position that health should be a central consideration to climate change-related work and discussions, and hopes that this leadership and advocacy alliance can allow the voices of future and current healthcare professionals to be heard, to be listened to, and to be acted upon, with the goal of recovering into a better normal.
Dear friends of Healthcare Without Harm, Southeast Asia, warm congratulations. I know that you are launching a new alliance for health and climate in Southeast Asia countries, and we are very happy with that. I love the name, RISE, and I love as well your ambition for a healthy, climate resilient, and just a society. What else? So we need you. Keep with that, and please rise.
And that was our solidarity video presentation. Thank you very much. Now, as we wrap up today's launching, we cannot end without the declaration of commitments by our RISE Southeast Asia partners. So to our Southeast Asia partners, while I call you one by one, please ready your placards and read out loud your pledges. We start with our pledge from Singapore, Ms. Yen Tan, and that will be followed by Malaysia, Philippines, Indonesia, Taiwan. Ms. Yen Tan, can you please read your pledge?
Who Take Part Hospital in Singapore commits to healthcare climate action and a healthy recovery.
Thank you, Ms. Yen. And now for Malaysia, Mr. Hafiz Amirul.
That RISE Malaysia committed untuk tindakan iklim dan kesihatan serta proses pemulihan yang sehat.
Thank you. And from the Philippines, Dr. Ronald Lau, can you please read your pledge?
Okay. Ang RISE Pilipinas ay nangangako na makabuluhang aksyon para sa klima at kalusugan at sa isang malusog at makatarungan na pagbangon.
Maraming salamat po, Dr. Ronald Lau. And now from Indonesia, Dr. Hervey Nuriania Megareza, can you please read your pledge?
RISE Indonesia berkomitmen mendukung aksi penyelamatan iklim dalam kegiatan pelayanan dan pemulihan tatanan kesehatan menuju Indonesia yang lebih sehat.
Thank you so much. And from Taiwan, Dr. Mingnan Lin, please read your pledge.
台湾奋起 Rise Taiwan 承诺健康照护部门请持续精进气候行动与维护健康。Thank you.
Thank you. And now finally, for Healthcare Without Harm Southeast Asia, Ramon San Pascual, please read your pledge. Our panelists to switch off their virtual backgrounds so that we can see the placards. And since this is a group photo op, everybody in this Zoom room, please give your biggest smiles to a healthier, brighter Southeast Asia. One. Is somebody from the team doing the screenshot? All right. 1, 2, 3. Smiles, everybody. And another one. 3, 2, 1. Team, are we good? Did we get a screenshot? To officially launch RISE Southeast Asia on behalf of the HCWH Board of Trustees.
Thank you so much. And we are really humbled by this quite a historic virtual event. The COVID-19 pandemic showed us that the normal we are used to was unsustainable, destructive, and if continued alongside the lack of stronger action to address the climate crisis, will only mean continuing destruction of human lives and our planet. In Southeast Asia, where environmental and health issues like climate change, air pollution would mean severe health inequity, lack of resilient health infrastructures, gender inequity, and food insecurity, it is imperative for the healthcare sector to lead and ensure a safer, healthier, and more equitable recovery from the coronavirus pandemic and the climate crisis. And as a direct response, I'm very proud and grateful at the same time that Healthcare Without Harm Southeast Asia office is given this opportunity to facilitate the formation of this new alliance. Therefore, on behalf of our Board of Trustees and me as Executive Director of Healthcare Without Harm Southeast Asia, we hereby declare the launch and the start of the good work that the RISE Southeast Asia Alliance will pursue from here on to achieve climate action, health equity, resilience, and healthy recovery for Southeast Asia. Thank you very much. Mabuhay.
Please give yourselves a big round of applause for going through this launching for RISE Southeast Asia. Truly, it's going to be a bright future for us at Southeast Asia with this kind of partnership. Thank you everyone for dedicating your time and energy to being here. For our friends in the media, you can please stay for our press conference so that you may do interviews with our panelists and other esteemed guest speakers. Once again, my name is Val Vestil, all the way from the Philippines. Maraming salamat po, and we are looking forward to RISE.